If you are over 60, one of the fish you eat for memory may be the wrong one. Some fish can support the aging brain. Others may quietly bring in more mercury than your nerves should have to handle. And the most confusing part is this. One of them may already be in your kitchen. Hello, I'm Dr. Claire Bennett. Today, I want to walk you through 4 fish older adults should avoid eating regularly, and 4 better choices that can support brain health more safely. Stay with me until the end, because I'll give you a simple 4-line list you can take to the grocery store, the fish to avoid, and the fish to choose more often. Before we name the fish, let me be very clear. This is not a video telling you to fear seafood. Fish can be one of the most useful foods for people over 60. It can provide high-quality protein to help maintain muscle, omega-3 fats that support the brain and blood vessels, and nutrients such as vitamin D, selenium, iodine, and vitamin B12. The issue is not whether fish is good or bad. The real issue is whether you are choosing the right fish often enough and avoiding the wrong fish often enough. This matters more after 60 because the body becomes less forgiving. Your kidneys may not clear certain substances as efficiently as they once did. Your nerves may already be more sensitive because of diabetes, vitamin B12 deficiency, circulation problems, medication side effects, or age-related changes. Your balance and reaction time may not be as sharp as they once were. So when we talk about mercury in fish, we are not trying to create fear. We are trying to remove one avoidable burden from a body that is already working hard. The easiest way to understand mercury in fish is to think about the food chain. Small fish are eaten by medium fish, and medium fish are eaten by larger predatory fish. The bigger and older the predator, the more time it has had to accumulate mercury from what it eats. That is why a large, beautiful piece of fish is not always the healthiest piece of fish for an older adult. So the goal is simple. After 60, when you choose fish for brain health, you want 3 things working together. You want omega-3 fats, you want lower mercury, and you want a fish you can prepare in a realistic, senior-friendly way. Not deep-fried every time, not buried in salt, and not so complicated that you never make it. Let's begin with the 4 fish I would be careful about eating regularly. The first is swordfish. Swordfish often looks like a healthy choice because it is firm, meaty, and served like a steak. Many people choose it when they are trying to eat less red meat, and I understand why. It feels satisfying, it looks lean, it grills well. But swordfish is a large predatory fish, and that is exactly where the concern begins. Because it lives higher in the food chain, it can carry higher mercury levels than smaller fish. Mercury is tricky because you cannot taste it. It does not make the fish smell wrong. It does not change the color of the meal. A swordfish dinner may look elegant and healthy, but if it becomes a regular habit, it is not the fish I would choose for an older adult who is trying to protect brain and nerve health. One special dinner is not the same as eating it every week, but for routine meals, there are better choices. The second fish to avoid eating regularly is shark. Now, many people immediately say, Dr. Bennett, I don't eat shark. And that may be true. But shark can appear under different names depending on the restaurant, fish market, or country you are in. Sometimes it is sold as steaks. Sometimes people try it while traveling. Sometimes it is used in local dishes where the name does not sound obvious. The reason shark is a concern is the same reason swordfish is a concern. It is a large predator, and large predatory fish can accumulate more mercury over time. For a younger, healthy adult, occasional exposure may not feel like a major concern. But for someone over 60 who already has tingling, tremor, balance issues, memory concerns, kidney disease, or several medications in the picture, I would rather remove unnecessary risk wherever possible. A common mistake is judging fish by how clean or lean it looks. People may say, it's white fish, so it must be light, or it is grilled, so it must be healthy. But mercury is not about whether a fish is white, pink, oily, lean, grilled, or baked. Mercury risk depends more on the species, size, age, and place in the food chain. So if shark appears on a menu and your goal is brain health after 60, I would choose something else. The third fish is king mackerel, and this one deserves careful attention because it causes a lot of confusion. Not all mackerel is the same. King mackerel is not the same as Atlantic mackerel. This is one of the most important distinctions in the entire video. Many older adults hear the word mackerel and think, I've heard mackerel is good for omega-3s. And that can be true, depending on the type. Atlantic mackerel can be a useful omega-3 rich choice, but king mackerel is a higher mercury fish, and it is not the one I would want on a senior's plate every week. This is where labels matter. If a package says Atlantic mackerel, that is very different from king mackerel. If a restaurant simply says mackerel and no one can tell you what kind it is, do not guess. Choose another fish you recognize. After 60, the safest habit is not to memorize every species in the ocean. The safest habit is to know your few reliable choices and return to them. If this is the part that surprised you, save this video or write it down, because mackerel is one of the places where many well-meaning seniors make an honest mistake. The word sounds healthy, but the type of mackerel changes the whole story. The fourth fish to avoid eating regularly is big-eye tuna, and I also want you to be cautious with large, fresh, or frozen tuna steaks. Tuna is probably the most confusing fish on this list because it is everywhere. There is canned light tuna, albacore tuna, yellowfin tuna, big-eye tuna, tuna steak, tuna sushi, tuna salad, and tuna in poke bowls. So when people ask, is tuna good or bad? The honest answer is, it depends on the type and how often you eat it. Big-eye tuna is considered a higher mercury fish, and large tuna steaks can also be more concerning because larger tuna tend to accumulate more mercury. Canned light tuna is often lower in mercury than big-eye tuna or large tuna steaks, but that does not mean tuna should become an everyday food for older adults. I meet many seniors who eat tuna almost daily because it is convenient, it is soft, it is affordable, it keeps in the cupboard, it makes an easy sandwich. For someone living alone or feeling tired at lunchtime, I completely understand the appeal. But if tuna becomes your default protein 5 or 6 days a week, it may be time to rotate. You do not need to panic. You simply need variety. Try salmon salad one day, sardines on toast another day, egg salad another day, lentil soup another day, and tuna only occasionally. That kind of rotation lowers your reliance on one fish and gives your body a wider range of nutrients. There is one more point that older adults often forget. If you eat fish caught by family, neighbors, or local fishermen, do not assume it is automatically safer because it is fresh or local. Local fish can be wonderful, but lakes and rivers may have their own advisories because of mercury or other contaminants. If you regularly eat fish caught from local waters, check the local fish advisory for your area or ask your public health office. Fresh does not always mean low mercury, and homemade does not always mean risk-free. Another thing I want you to remember is that mercury is a long-term pattern issue. Most people do not need to panic because they had one restaurant meal or one vacation meal. What matters is the pattern you repeat week after week. That is actually good news because patterns are something you can change gently. You do not need to throw away every food you enjoy. You can simply make your regular choices safer. When we talk about brain health, I also want to keep our promises honest. Eating salmon or sardines will not cure dementia. It will not reverse memory loss overnight. It will not replace sleep, movement, blood pressure treatment, diabetes care, or medication review. But food does matter because the brain is living tissue. It needs blood flow. It needs steady energy. It needs enough protein to support the body around it. It needs healthy fats as part of cell membranes. So when we choose low mercury, omega-3 rich fish, we are not chasing a miracle. We are building a better environment for the brain to age in. If you are caring for yourself, that may sound small, but small changes are often the ones that last. A person who replaces 2 tuna lunches a week with salmon or sardines has made a real change. A person who stops buying swordfish as a weekly healthy steak has made a real change. A person who learns the difference between king mackerel and Atlantic mackerel has made a real change. These are not dramatic decisions, but they are practical decisions. And practical decisions are what protect older adults in everyday life. Now, if you are listening and thinking, should I stop eating fish altogether? Please don't take that message from this video. That would be the wrong lesson. The goal is not to remove fish from your life. The goal is to remove the wrong fish from your routine. And remember, the goal is not to win an argument about fish. The goal is to make the next meal a little safer, a little more nourishing, and a little easier to repeat. The first better choice is salmon. Salmon is one of the easiest fish to recommend because it gives older adults several benefits at once. It is rich in omega-3 fats, especially EPA and DHA. It provides high-quality protein. It is generally lower in mercury than large predatory fish, and when cooked properly, it becomes soft, moist, and easy to chew. That last point matters more than many people realize. A healthy food is only helpful if you can actually eat it comfortably. Some older adults struggle with dry meat, dental issues, dentures, reduced appetite, or dry mouth from medications. A gently baked piece of salmon can be much easier to manage than a tough steak or dry chicken breast. A simple senior-friendly salmon meal might be baked salmon with cooked vegetables and a soft carbohydrate such as sweet potato, brown rice, or barley. You can flavor it with lemon, dill, parsley, garlic, or a little olive oil instead of relying on heavy sauces. If fresh salmon is too expensive, canned salmon can still be useful. Just compare sodium levels when possible, and choose boneless versions if small bones make you uncomfortable. The second better choice is sardines. Sardines are small fish, and small fish are often a smart choice because they are lower on the food chain. They provide omega-3 fats, protein, vitamin D, and sometimes calcium if the soft bones are eaten. They are also affordable, shelf-stable, and easy to prepare, which makes them very practical for older adults who do not want to cook a full meal every day. Now, I know sardines are not everyone's favorite. Some people find the smell too strong, and that is fair, but you do not have to eat them straight from the can. You can mash them with lemon and a small amount of olive oil. You can add them to whole grain toast. You can mix a small amount into tomato sauce. You can add them to a salad where the flavor is balanced with vegetables and herbs. The main caution with sardines is sodium. Canned sardines can be salty, and this matters if you have high blood pressure, heart failure, kidney disease, or swelling in the legs. So check the label. Choose lower sodium options when you can, drain the liquid if appropriate, and avoid pairing them with several other salty foods in the same meal. The third better choice is rainbow trout. Trout is a gentle, mild fish that many older adults tolerate well. It does not usually have the strong flavor of sardines, and it is softer than many meats. It can provide omega-3 fats while staying away from the high mercury concerns of the large predatory fish we discussed earlier. Trout is especially helpful for people who say, "I want to eat fish, but I do not like fishy fish." It cooks quickly, works well baked or gently pan-cooked, and does not need breading or deep frying to taste good. A little lemon, garlic, parsley, or yogurt-based sauce can make it flavorful without turning it into a heavy meal. For brain health, trout fits into the bigger picture because the brain depends on healthy blood vessels. Memory is not only about brain cells, it is also about the tiny blood vessels that bring oxygen and nutrients to those cells. High blood pressure, diabetes, smoking, poor sleep, and heavily processed foods can all affect those vessels. Trout will not erase those risks, but it can be one helpful part of a healthier eating pattern. The fourth better choice is Atlantic mackerel. I am saying the full name again on purpose, Atlantic mackerel, not king mackerel. Atlantic mackerel can be rich in omega-3 fats and can be a strong option for older adults who enjoy a fuller flavored fish. But because king mackerel is a fish to avoid regularly, you must not assume all mackerel is the same. If you buy canned mackerel, look for the species name. If you cannot tell which type it is, choose salmon, sardines, or trout instead. There is no need to take a guess when safer, clearer choices are available. Atlantic mackerel can be delicious with lemon, mustard, vinegar, herbs, or vegetables. But once again, pay attention to sodium, especially with canned or smoked versions. A brain-supportive fish meal can quickly become a blood pressure problem if it is served with salty crackers, pickles, processed cheese, and canned soup. The fish may be a good choice, but the plate around the fish still matters. This is where I want you to think in terms of a whole meal, not one magic food. A good plate might include low-mercury fish, cooked vegetables, a fiber-rich carbohydrate, and a small amount of healthy fat. That is not dramatic, but it is repeatable. And in senior nutrition, repeatable matters more than perfect. Now let's talk about how often to eat fish. For many adults, a reasonable goal is about 2 servings of fish per week, especially fatty fish, as part of an overall healthy eating pattern. A serving does not need to be a giant restaurant portion. Think of something closer to the size of your palm, about 3 to 4 ounces cooked. But this advice should be adjusted for your own health situation. If you have kidney disease, severe gout, a fish allergy, swallowing problems, or a medically prescribed diet, talk with your doctor or registered dietitian. If you take blood thinners or have a procedure coming up, normal food portions of fish are very different from high-dose fish oil supplements, but it is still wise to ask before starting supplements. And that brings me to a common mistake, assuming fish oil capsules are automatically better than eating fish. Many people over 60 take fish oil because they want to protect memory, but supplements are not the same as food. They can vary in dose and quality, and they may not be right for every person. So, if you are taking fish oil, bring the bottle to your pharmacist or doctor and ask, is this appropriate for me with my medications and my health conditions? Food first is often the safer conversation. Now, I promised you a simple grocery store method, so here it is. When you are choosing fish, ask 4 questions. First, is this fish known to be high in mercury? If it is swordfish, shark, king mackerel, or big-eye tuna, do not make it a regular habit. Second, does it provide omega-3 fats? Salmon, sardines, rainbow trout, and Atlantic mackerel are good examples. Third, is it too salty? This matters especially with canned, smoked, pickled, or processed fish. Fourth, can I prepare it in a way that actually supports my health? Baked, steamed, or gently pan-cooked fish is usually a better routine than deep-fried fish covered in salty sauce. Let me make this even more practical. If you eat tuna sandwiches 5 days a week because lunch is hard, do not feel guilty. Just rotate. Replace some of those tuna lunches with salmon salad, sardines on toast, eggs, beans, lentil soup, or leftover trout. If you enjoy fried fish on Fridays, you do not have to remove the tradition completely, but try making baked salmon or trout your more regular habit. If you dislike fish smell, choose milder fish like salmon or trout, cook it with lemon, and avoid overcooking it because overcooked fish often smells stronger and becomes dry. If you are on a tight budget, do not assume healthy fish must be fresh and expensive. Canned salmon, canned sardines, and canned Atlantic mackerel can be useful. Frozen salmon or trout portions can also be more affordable than fresh fish. Just keep an eye on sodium in sauces. If you worry about bones, choose boneless canned fish or carefully checked fillets. And if you cough during meals, feel food sticking in your throat, or have had choking episodes, please do not ignore that. Swallowing problems deserve medical attention, especially in older adults. I also want to speak for a moment to family members caring for an older parent. Please do not simply say, "Stop eating that fish." Food habits are emotional. They come from culture, childhood, budget, loneliness, convenience, and routine. A better approach is to say, "Let's find a fish that gives you the benefit with less mercury." Then make the better choice easier. Put canned salmon in the cupboard. Buy frozen salmon portions. Try trout once and see if they like it. Choose lower sodium sardines. Advice works best when the healthy choice is also the easy choice. And if your parent has memory problems, simplify the list. Avoid regularly. Swordfish, shark, king mackerel, big-eye tuna. Choose more often. Salmon, sardines, rainbow trout, Atlantic mackerel. Write it on a small card and keep it near the grocery list. That small card may prevent a lot of confusion. Before we close, let's clear up 3 myths. The first myth is that expensive fish is always healthier. Not true. Some expensive fish are high in mercury, and some affordable fish are excellent choices. The second myth is that white fish is always safer than oily fish. Also not true. Mercury depends more on the species and food chain than the color of the flesh. The third myth is that eating fish means you do not need to care about the rest of your diet. I wish it were that simple. Brain health is built from patterns: steady blood pressure, stable blood sugar, good sleep, movement, hearing care, medication review, and meals with enough protein, fiber, vegetables, and healthy fats. So here is the message I want you to remember. After 60, fish can be one of your best foods for brain and heart health, but only if you choose wisely. Do not make a regular habit of swordfish, shark, king mackerel, or big-eye tuna. Be cautious with large tuna steaks. Choose salmon, sardines, rainbow trout, and Atlantic mackerel more often. Keep portions moderate, watch sodium, rotate your choices, and cook fish in a way that keeps the meal gentle on your body. And if this helped you, share it with someone over 60 who eats fish often. Then tell me in the comments which fish you eat most at home: tuna, salmon, sardines, trout, or something else, because your answer may help another viewer realize they are not the only one trying to make sense of all this. The safest brain health plate is not dramatic. It is steady. It is a low mercury fish, some vegetables, enough protein, enough fiber, and a meal you can repeat without worry. And sometimes, after 60, that quiet, steady choice is exactly what helps the brain age with more strength.